All right, we're officially rolling. Hopefully we don't have any retakes to do because it's late and I'm really, really tired. You can't see what time it is when I ask you what time it is, so I just have to like read that stuff up. So anyway, we're gonna start here with the musculoskeletal system exam. There's a lot to go over, so first of all, let's just go over like where everything is that we're going over the joints. So first we're going to deal with the temporomandibular joint right here, and then next we're going to do the cervical spine, which is here in the neck, and then we're going to do shoulders, elbow, wrists, and hand, like the fingers and the phalanges. We're going to do the hip here. Ooh, I can feel the iliac crest, maybe, is that? Or the bony prominence. We're going to do knees, and then we're going to do ankles and ankle and foot. And then we're also going to be doing the thoracic and lumbar spine in the back. So this is a long one. I guess we're just going to start at the temporomandibular, and with the temporomandibular, we are basically going to take a look at everything.
That's just a touch.
Yeah, okay. So we're going to look at everything, make sure I can still see. All right, we're good. So we're going to take a look at everything. We're going to inspect, make sure things look symmetrical. We're going to check color, temperature. We're going to do all this stuff while we're inspecting and touching. So we're look, everything looks good, then we're going to touch, and then you're going to do range of motion where you're going to, I can feel pressure on both sides evenly. So that's good. And I don't feel anything, I don't feel any heat. I don't see any swelling. I don't see any redness. Good range of motion. So then we're going to move on why did I take my paper down? Hold on. So then we're going to move on to the cervical spine. So cervical spine is the neck, basically, and we're going to want to take a look and make sure everything's looking even. I really kind of feel like the neck you're going to be looking at from the back. We're gonna touch it. We're gonna look for swelling. Look for any kind of redness, and then I'm gonna just palpate. I want to make sure I'm feeling into the muscles and the joints and checking all over in here in the neck. I want to make sure that I don't feel any nodules or any masses or anything, that he's not hot to the touch. I want to check your range of motion. So with that, on the cervical spine, I want to make sure that it's firm with no muscle spasms. And then when we do the range of motion, I want you to touch your chin to your chest. And then I want you to look up at the sky, and then I want you to turn to the left and turn your head to the right. So he's got good range of motion, looks symmetric, looks equal, like he can turn the same way to the left as to the right. So then we're going to move on from there. Let's make sure that we're doing everything. So size, contour, range of motion, symmetry, color, swelling. All right, cool. Temperature, we did all that. We checked that we were feeling for the muscles. All right, so we did all that. So we're going to move to the shoulders. So now we're going to move to the shoulders. Shoulders, we're going to inspect and compare. We want to inspect and compare both shoulders. Make sure that things look even, symmetrical. You kind of want to check from the front and the back superior, posteriorly as well as interiorly. We want to make sure that we want to check the size of the shoulders, make sure everything looks, make sure the contour of the joint looks right. Next, we're going to just check for redness. We want to make sure there's no inflammation or swelling, no masses. We're also going to have to, palpate. We're going to have to touch everything. I want you to move your shoulders some while I'm touching. just so I can kind of get in here and feel for crepitation, or it's joint, like squeaky joints, basically, that make a bunch of noise. So we're gonna wanna just check everything, we wanna feel where the bony prominences are, the synovial joints. I wanna check this, feel the joints, feel the muscles. And then we wanna do range of motion. So the shoulders for our range of motion, we are going to, we're gonna show you all the different stuff. So we've got, hold on. So first I've got flexion, which is forward. And then we've got hyperextension, which is backwards. So we're trying to check to see how even things look. Then we've got internal rotation, which is at your head. And then we do abduction, which is up, like away. It's like usually it's away from your abs, so it's weird. It's up, yep. And then adduction is down, like this. And then we can do external rotation, which is behind your back. Perfect. So those are our normal rotations. And so the thing about this is there is a lot of abnormal things that there could be going on with the shoulders. You could have something going on with your rotator, your rotator cuff lesion. Also, let's see. Also, with the shoulders, sometimes there can be referred pain. So, like, you can have pain in your shoulders that is coming from a hiatal hernia or cardiac or pleural. So there's a lot of things going on. You want to make sure that there's no atrophy, no deformities, no swelling, nothing like that. So then we move to the elbow. With the elbow, we're going to take a look at everything. We're going to inspect the elbows. We're going to feel, make sure we're going to make sure there's no redness, make sure they're not warm to the touch. We're going to palpate with our fingers, and you can do some flexion while I'm touching, making sure I don't hear any, creaky joints here. I'm also going to feel, I'm trying to feel in the joints and for the bony articulations, all of that. I'm going to check your range of motion. So range of motion, we're going to do flexion and extension. And he looks like he's got equal range and range of motion there, so that's good. Then next, we're going to move over to phalanx. We're going to do the wrist and the hands next. So with the wrist, I forgot to say, we also are always checking for swelling, inflammation. We're doing that every time. So with the wrist and the hands, we want to inspect, and we also want to look at the color, and we want to feel for temperature. We want to feel in the joints. We want to see, make sure everything's working and looking good. All right, and then we're also going to check the phalanges. There's two different sets of joints in your fingers, so we're trying to kind of feel everything and make sure we don't see any, also with all the times we're inspecting, we're also going to try to make sure that there's no synovial thickening there's no fluid that's thickening, which I assume would look like inflammation, or you would be able to see it and maybe even feel it. It's a little bit new to me. So with the wrist and the hand, we're also going to need to wrist and the hand, which we check the range of motion. Also, I need to do supine, which is up, and then pronation. So that's good. That's important. That's also important when we're checking your elbows as well as with your wrists and your hands. Then we're going to do Phalen's test. Phalen's test, you're going to put your Right, you're gonna put your dorsal part of your hands together for 60 seconds and be kind of pressing sort of semi, hard, I guess. And so, we would count to 60 seconds, and then afterwards he either would have no, it would be negative, and he would not have any kind of carpal tunnel, and there's no numbness or tingling or pain, or when he lets go, he's gonna have a lot of pain. You can let go. How's things feeling okay?
It's fine.
Then we do the next test, which is the Tinel sign. So sorry, I just need to look at how you say it. So with the Tinel sign, we're also checking for carpal tunnel, and I'm just going to tap on the median nerve. Does that hurt at all? And so that's also, if that hurts him, that's also a sign of possible carpal tunnel. So let's see, where are we? Next, we are going to move to. Next, we're moving to the lower extremities. We're going to do hip, knee, ankle, foot, and spine. So the hip, we're wanting to inspect it. Later on, when we're doing the neuro, he does a lot of walking around and standing, and that's a good time for me to check when he's standing and inspect. Right now, the hips, we're looking good. I don't feel any warmth to the touch. We're seeing if how's the contour. Want to palpate them and feel into the joints. This is kind of new to me, so I want to make sure that there's no inflammation, no swelling. So yeah, that's that. No redness. Redness is the main thing we're looking for when we look at all of the joints. Also, when you're trying to feel between the joints and the muscles, because they feel a little bit different, but I'll learn more as I go how to feel sort of the difference between the muscles and the joints. So then we move to the knee. The knees are really intense because this is your prime mover. This is where all your this is where, did I mess that up? Hold on, let me get my pages right. Phelan's test, hip, cool. Oh, I forgot to do range of motion with your hip. So with that, we're just gonna have you lift the knee. We're gonna have you lift the knee against the pressure, just like we kind of did at the end of the last one with the iliopsoas. So, we just want to make sure everything's functioning on your hip motion, so you're looking good. Next, we move to the knee. So the knee is really important because it carries all your weight. Is what I was thinking. Is that not what I put in my notes? So we're gonna inspect your knee. We want to inspect the knees. We want to make sure they look the same. We want to look for redness, contour, color. Make sure there's nothing abnormal, no swelling, no deformities. I didn't mention deformities before, but with everything, deformities is going to be dislocations or anything of that, tears, atrophy, swelling, all that, nodules, masses. Also, the swelling, you have, again, the thickening of the synovial fluid. And so the knee can be very complicated. And you want to make sure you're feeling this quadricep muscles as well when you're palpating, and you're feeling everything around the knee. And you can do, if you don't mind moving it a little for me, I'm just kind of feeling it. Move the other one too. So you want to move from up to down. And there's a lot going on at the knee. So your main thing is a hinge joint. So you're doing flexion and extension like you were showing you. So good. There's flexion or extension. And then flexion, extension. So that's your knee. And he's got fine range of motion. You know, like I said, we felt all his joints and everything. And then we moved to the foot. And the foot, we're gonna look at the ankles and the feet. Let me see. So we're gonna look at the ankles and we're gonna feel them, move them around a little. Dorsal flex and plantar flex. So plantar flex is when you're going down towards the gas pedal, and dorsal flex is when you're going up towards the sky or back towards your nose, whatever. Those are your range of motion mainly, and you can do some other inversion and eversion and stuff, but so yeah, we're gonna palpate all this, and we can feel the bony articulations and for the joints and all of this. We're looking to make sure everything's even in the contours, and we also want to feel the feet and the toes and the phalanges. We want to feel into the joints here and make sure everything feels all good. There's no nodules or fluid. So let's see what's next. Are we having fun yet?
Tons.
Lots and lots of fun. All right, so we just did all that. Then we have to go to the spine. So next, we're going to go to the spine. So we're going to be checking the thoracic and the lumbar. This isn't, so you're going to stand anyway for this. With this, I'm going to make sure that he's symmetrical. I'm looking kind of just to see if he's even and make sure there's no, if I had his shirt off, I'd be seeing if there's any red spots. Touch it, make sure his skin's smooth, not hot. So now we're going to check range of motion. So the spine is actually really important. There's a lot of things that happen when you get older. You can get how is it called? The chiosis, hold on. I took some notes about it. Kyphosis, and then also if you're overweight, you can get the lordosis, which is curvatures of the spine. So this is actually one of the ways you check is when they bend over, you can make dots on their spine, on their little bony parts, and when they stand up, see if they line. But so he just did flexion, and now you're going to do extension. You can lean back. And then also you can twist, like, yeah. And so so that's how you check range of motion there. You can sit back down maybe. And so was that, let's see. Did I get everything? I feel like that's everything on this sheet. That we've taken care of. Okay, so now we're going to move to the neurological system. There's a lot going on here. So, neurological system, we're going to do level of consciousness. With level of consciousness, this has a lot to do with like when we walk in the room and our patient looks at us or opens his eyes and sees us, what level. And so with the level of consciousness, we use the Glasgow Coma Scale, and that rating is 3 through 15. There's no such thing as a 0, from what I understand. And so my patient, I walk in the room, he has spontaneous eye opening, he follows commands, and he's fully oriented. So he's going to have, my patient's going to have a 15. So we're going to move on from level of consciousness to orientation. With orientation, I'm going to say, hey, what's your name?
Dan.
Hey, where are you?
Kentucky.
And what time is it? He goes,
It's 11:10.
11:10. Gotcha. So that's orientation. It's pretty easy, person, place, time. Then we move on to memory. We do short term, long term. Hey, what did you, short term, what did you have for dinner?
Pork chop.
And then where were you, what hospital were you born in?
I do not know.
Oh, goodness. Okay. What high school did you go to?
LaVille, junior, senior.
All right, perfect. See, we should have rehearsed that one better when we did it last time. I changed the question on them. All right.
The city I was born in.
Right. So, moving on, short term, long term. It's hard sometimes. I got to figure out how you do long term if you don't know a person. But next, we got to do motor functions. So let's see. Let me just get caught up on my notes in case I need them. Memory. All right, cool. So next, we're going to do motor function. With motor function. Motor function, we're going to check the gait. So with the gait, you're going to walk across the room. He's going to walk across the room a little bit, and we just want to make sure that he's not limping, that he has a nice walk. Go back to your chair, that he's not shuffling, that kind of thing. And then I'm going to check for balance. So he can walk on his heels or his toes, or he can go heel to toe. Oh, look at that. He's walking on his toes. Walking on his heels, he's got good balance, so that's good. Then we move on. So first of all, with all of that, there are a lot of abnormal gaits, and we're watching for this. What we're watching for is we're looking for uncoordinated and an uncoordinated or unsteady gait. If he has that, it's sometimes called ataxia, and there's a lot of different things that it can be, Parkinson's, scissor. I mean, there's a lot of different gaits. So, luckily he walked normal, so we're good to go. Balance is good. Then we do Romberg's test. So Romberg's test is where you're gonna stand up and you're gonna put your feet together and your hands to your side, and you're gonna close your eyes for 20 seconds. And we're going to stay close to him and make sure that nobody falls over. So he does this for 20 seconds. We want to make sure he's not swaying. He's actually doing a really good job now that we've tried this a few times. All right, you're good to go. And actually, Romberg's test, if he was swaying, he would be positive, and that would be possibly for cerebellar ataxia. That could be mainly what we're looking, that could be it could be from alcohol intoxication or multiple sclerosis. But luckily he wasn't swaying, so we're negative, so we're in the good. Next we're going to go to coordination and skilled movements. With that, we have the first one we're going to do is rapid alternating movements. So you're going to do the thing where you tap on your knees and you're going to do like supine pronation. All right, so that looks good. And then next we're going to do rapid finger to thumb. So there you go. You're good at that. I'm not very good at that. Next, we're going to do finger to finger test. He touches his nose and then he touches my finger. So you're going to touch your nose and then touch my finger. Touch your nose, touch my finger. You can just do it all with the same hand. So this nose, finger. Oh, nose, finger.
Well, I should look at your finger.
Nose, finger. He's kind of messing around, but it's going to be okay. So then we're going to do finger to nose test. So you're going to do like the one we were practicing earlier where you put your hands out and touch your nose to your finger. Oh yeah, you're doing such a good job. I love it. All right, then we're going to do the heel to shin. And I think you can just sit down doing it. It's fine. And look at that. See, he's trained. We're doing good here. So we want to make sure all of those were, we want to make sure all of those movements were smooth, and that, that he looked coordinated. Sometimes that can be hard to do. So the thing with those were all, these were all motor functions. And so if there's an issue with these motor functions, it could be a cerebellar function that's messed up. There could be cerebellar disease. Cerebellar disease or alcohol intoxication. So those are the things that we're checking for here. Next, we're going to move to sensory sensory functions, and we're going to do the spinothalamic tract. So I've got, let me get all my little tools over here. I guess I might as well put them over here, I feel. So we're going to do the spinothalamic tract. First, we're going to do light touch. So close your eyes and tell me when you feel. Just say, you know, yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes.
And you want to make
Yes.
sure you
Yes.
do
Yes.
this.
Yes. 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 Yes.
He's feeling all my light touches, so this is good. And then we're gonna do sharp and dull on. So when I keep your eyes closed, and when I do it, you're gonna tell me whether it's sharp or whether it's dull.
Felt sharp.
It was.
Dull. Yeah, I couldn't tell you to press hard now. That's dull. Sharp. Dull. No, sharp.
Sharp.
Right. My eyes are open now.
Dull. Anyway, so I'm not good at this, obviously, but and we're gonna do that on the lower extremities as well. I have a toothpick and a cotton swab, and I'm not doing my cotton swab hard enough or my toothpick soft enough. I don't know. Anyway, so that's the sharp and dull test. All right. So after the sharp and dull test, we also if they had a temperature, if they had any pain with that, we would actually want to check their temperature, or if they didn't know what they were doing there and there was something wrong, then we need to check their temperature. But next we're going to move to the posterior column test. So don't laugh. I have my friend is someone that's like in my family is a doctor, and so I asked him for like a little, like some of his leftover doctor's stuff, and so he gave me a tuning fork. So I've been playing with it, and it's not the easiest thing I've ever done, but anyhow, I've been trying to learn a little bit about it. Let's see. Why do I feel like I just got off? Anyway, so, right, if there's a pain sensation, we check the temperature. Next, we go to the posterior column test with the tuning fork. So here, the first thing that we do is I would hit it, and then I put it over the bony prominence, and then I tell him to tell me when he stops feeling it, and I do it at each hand. I don't really know what I'm doing, so. You know, but anyway, so
Stop.
right, and then we do it in the,
Stop.
Anyway, so I'm learning how to do this. It's not the easiest thing. This is where we check for neuropathy. This is important for people that are diabetic. This is important if someone's a diabetic or alcoholism. So that's the idea behind that. Then we are going to do the position test, and this is where I'm going to take your finger, and I want to make sure I go to the outside, and you're going to close your eyes, and you're going to tell me whether I'm going to move it, whether I'm moving it down or up.
Up.
I'm going to do the other finger because it just feels more right for me.
Up. Down. Up. Down.
And then we're going to do the same thing on this finger.
Up. Down. Up. Down.
And then we would also do that on his feet. I would do with his big toe.
Up. Down. Up. Down.
And then we're pretending these are his toes.
Up.
Although I think you might be able to see his toes in this.
Down.
I think you might be able to see his toes in this video.
Gross.
Next, we're going to do tactile discrimination. So I'm going to have you close your eyes and reach out a hand here. What's in this hand?
Feels like a pen.
Okay, what's in this hand?
Rubber band.
All right, good job. So see, he knows what they are. So this is good. That's stereognosis. Next we do the graph. We do the graph. So look, see, I even have the reflex hammer too, the hammer. So the next is graphisia. I can't say it very well. Graphisia. All right, so hand me your hands, and you're gonna tell me what number I'm doing.
3,
All right, and then the other hand.
2,
See, I didn't tell him what to say either. He got those right, so that's good. Then we're gonna do point location, where I'm gonna. Okay, so I'm gonna touch you someplace, and then you're gonna touch where I touched you. Anyway, so that's position with the posterior column test. Let's see, what is next? Posterior column test, vibration, position, the kinesthesia, right, nice. Tactile discrimination, we just did all that. All right, now we're moving to reflexes, deep tendon reflexes. All right, so we kind of practiced this a little, but first we're gonna do our biceps. So you wanna I'm gonna hold his forearm and he's gonna be relaxed. I'm gonna try to have him flex so I can feel where his tendon is and stuff. And then I'm gonna hit my thumb. Oh. And I don't know if I actually did it right or not. Are you being funny?
No.
Here, I did good. So, and you can feel like a bloop. I didn't do it as good as you. Yeah, anyway, so you see that there was a reflex, so we did kind of good there. And then when we're gonna deal with then we're gonna go next down to the tricep, which is a little bit more difficult. So we're gonna try to grab in the anti-orbital fossa and hit kind of here I'm gonna try to hit by the elbow. Oh, I feel him moving. I gotta work on this one a little bit. That worked fine. Next, we're gonna go to the brachioradialis. So that is going to, one second, let me move my page. All right, so I'm gonna hold your thumb out. You gotta be relaxed, and I'm gonna hit above the wrist. I don't really know. Oh, he did it. Huh? Yeah, so I don't know if you can see it, but I got things to work on, but for the most part, we're working on it. And then next is the patellar, this is the famous one. So you're gonna find the patellar. Most people go too low. And I think I hit with the big part, so let's see. Oh.
There you go.
I did pretty good, and his leg reflexed. And then next we're gonna do the, hold on, let me move him to my next paper so I know what I'm doing. Next we're gonna do the Achilles. Are we having fun yet? Hopefully we're still recording. So
Yeah.
Next we're gonna be doing the Achilles. So I'm gonna hold his foot in this sort of dorsal flexion. I want to kind of get his weight off of it, and then I'm gonna, I don't know if you can see it, but when I hit it, he like plantar flexes, his toes go.
Top of the foot too.
What?
Do it again.
Oh yeah, you can see the tendons go bloop. And then next, we are going to move on to clonus. So this is a set of rapid rhythmic contraction. This is a set of rapid rhythmic contractions on the foot. So this one's kind of weird. I sort of watched how you did it. So it's like I'm basically like gonna dorsiflex, plantar flex, and wiggle around, make your leg really loose. Dorsiflex, plantar flex, dorsi. and plantar, dorsey, wiggle around, and then I'm gonna dorsiflex real kind of hard, and like hold it. Not hard, but you know, I'm gonna be sturdy about it, and I'm holding it. And here, if there was something going on, I'd be able to feel in his calf muscles something spasming, and this would try to, I believe his foot would try to plantar flex. Hey, kitty. Hey, kitty. Anyway, so with that being said, Clonus, so he basically did what I think I needed him to do. The thing about Clonus is, in a baby, they actually do the opposite, they do the opposite of an adult. So anyhow, what are my notes? All right, so that's Clonus. Next, we're gonna go to the Babinski reflex, which is a superficial reflex. With the Babinski reflex, this is the one where he's very ticklish on the bottom of his foot. So, see, look, I did the same thing you did in the video. I have to get back down there. So I want to trace with the back of my reflex hammer on the outside of the foot, a J, up, and then he plantar flexes, and he's kind of ticklish once I get to the end of the J. Oh, but so if the Babinski reflex was positive, then, or he would dorsiflex really, and throw his toes wide apart. He didn't do that. He plantar flexed and moved towards the floor, which is a normal Babinski reflex. In the abnormal Babinski, they do opposite. So, sorry, I was talking about Clonus and the babies. That was totally incorrect. That had to do with the Babinski reflex and the babies. The babies, when I do that, they would do the opposite. They would automatically go up, and their feet, they would dorsiflex and put their toes out. So, all right. So anyhow, that is the Babinski reflex. And the reason why we do that is we're checking for UMN disease of the corticospinal tract. So, all right. Next, I think that's where we're at. I think we're getting somewhere. We're actually almost done. Thank goodness. All right, so next is the bedside neurological exam. So we're moving on. With this, first we are going to do the level of consciousness. So with the level of consciousness, I would walk into the room and I'm going to check if AVPU is what we do with this other scale for bedside. So I'm going to see if he's alert. When I walk in, he looks at me in the eyes, and his eyes are opening spontaneously. So that's good. But let's say I walked into the room and he doesn't look at me, and he's not making any kind of response to me. So he's not alert. So if he's not alert, then I'm going to move down to the verbal stimuli. So when I walk in the room and he doesn't look at me, I'm going to say, Dan, and he's not going to say anything. So he's not responding to a verbal, to my verbal words. So now, if he doesn't respond to verbal, then I'm going to do a painful stimuli, whether it be like a little pinch. But so he responded to the pinch or whatever, but let's say that he doesn't respond to me kind of touching on him or pinching on him a little. So if he doesn't respond to a painful stimuli, then we're going to move to the moved to the U, and we're going to try to Dan, we're going to try to do both at the same time, and then hopefully he, with some coaxing words and touching, we can get him to wake. So that's using the AVPU. Next, we're going to move on to orientation, and so the way I understand that the way that it was different from what we talked about earlier was that I say, so what is your name?
Dan.
What's your occupation?
Installer.
And what's your age?
47.
Oh goodness, you're old. Okay, cool. And then I say, where are you now?
Kentucky.
What city?
Louisville.
What state?
Kentucky.
All right. Well, 2 out of 3 in bed. Just kidding. Time. Okay, so time. What does this say? Okay, so your time. What is the time? What is the time?
11:31.
What's the day of the week?
Friday.
And the month.
June.
Anyway, so that was the idea of he's oriented. He's very oriented times 3. I actually have some questions about whether or not you're supposed to ask 3 of each or just person, place, and time. Anyway, moving on, we're going to move down to motor muscle strength. With that, I'm going to have him squeeze my hands as hard as he can. Squeeze really hard. I can't pull away, so that's really good. If it was abnormal, I would be able to pull out, and then we'd have a problem with muscle strength. Next, we're going to do just like we did at the end of the last video, where you're going to lift up with resistance on the iliopsa and check for resistance. So he did a really good job with that. So the last thing, or next thing we're going to do is a superficial touch. So close your eyes and we go, tell me when you feel it.
Feel it. Feel it. Feel it. Feel it.
So we did this earlier. Make sure you do the lower extremities. Next, we're going to do the sharp and dull again with the toothpick and the. I'm tired. I'm sorry. With the toothpick and the cotton swab. That's what we did earlier. And then next we do Perla. We get out our light and all that type of thing. So we want to check for his pupils. We want to do Perla. We want to see, are your pupils equal? Yes. Are they round? Yes. Are they reactive to light? So we're gonna check them for constriction. And we're gonna look at the other side too. And then reactive to light, so that's good. And checking the constriction. And then we do follow my finger, and we watch them. And so we're gonna watch the pupils constrict and make sure the eyes converge. So that's bedside neuro. Basically, like you were saying, it's sort of a highlight. It's kind of a highlight of the big neuro. It's basically just, it's done. It's done when you're doing bedside, and also just when you're in more of a hurry. It's not a full neuro examination. So I think we did okay. And thank you. Have a good night.